Dr. Zhen Chen from Hsinchu Magai Memory Hospital, Department of Nephrology in Taiwan. My article named Improvement of Mortality and End-Stage Renal Disease in Patients with Type 2 Diabetes after Acute Kidney Injury who were prescribed DPP4 inhibitors will appear in Mayo Clinic Proceedings. Dipeptidyl-peptidase 4 inhibitors users had a lower risk of ESRD and mortality and made a drug choice for patients with diabetes after weaning from dialysis requiring acute kidney injury. This article focuses on potential beneficial effects of DPP4 inhibitors on attenuating progression of diabetic kidney disease in reducing the long-term effect of the acute kidney injury to chronic kidney disease transition. We retrospectively collected data from the Taiwan National Health Insurance Research Database from January 1, 1999 to July 31, 2011. And we analyzed patients with diabetes weaning from dialysis required acute kidney injury. Cox proportional hazard models and inverse weighted estimates of the probability of treatment were used to adjust for treatment selection bias. The outcomes were incident ESRD, mortality, major adverse cardiovascular events, and hospitalized heart failure. A total of 6,165 patients with diabetes weaning from dialysis required acute kidney injury were identified. 5,635 patients were DPP4 inhibitor non-users, and 530 patients were DPP4 inhibitor users. We can find the final model after adjusting for age, sex, chronic kidney disease, advanced chronic kidney disease, and angiotensin-converting enzyme inhibitor or angiotensin II receptor blocker use. Compared with DPP4 inhibitor non-users, DPP4 inhibitor users had a significantly lower risk of ESRD. The hazard ratio is 0.81, and the lower all-cause mortality. The hazard ratio is 0.28. In contrast, the risk of major adverse cardiovascular events and hospitalized heart failure did not differ significantly between groups. This finding extends those of previous study on the safety of DPP4 inhibitor use and may shed further light on the management of acute kidney injury to chronic kidney disease transitional care, and the potential renal effect which may aid in treatment decision in routine clinical practice. We can give diabetic patients hope to decrease risk for further entering dialysis. We should do randomized control trial to further confirm the conclusion in this study. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.